The challenges for hand hygiene in intensive care in the past have been that it's just a very difficult thing to do in intensive care. Nurses and doctors are very busy, they've got a lot of other things to do, like keep the patient alive, and hand hygiene is just one of a long list of things that they need to do. In the past, compliance hadn't been so good here as probably most hospitals in the world, but to the credit of intensive care, they've really made quite an impact on that and really improved that over a couple of years. And some of the reasons for that are that we've made the hand hygiene product, the alcohol gel, much more accessible, and so it's much easier to do, it's quicker to do, it's accessible within the room so that nurses don't have to go too far to go and access that. But the other reason is really that the intensive care unit themselves and infection prevention unit have really tried to bring this issue to the attention of healthcare workers, and they've really done that quite well. So you'll see a lot of posters around, there's been a lot of education sessions and a lot of feedback and auditing as well. One thing that's unusual at the Alfred is that doctors and nurses almost do as well as each other. It's not to say that nurses don't do well, it's more that doctors do better than at most other hospitals. Usually there's a difference between doctor and nurse compliance with hand hygiene, but I think that's part of the cultural change that doctors have taken this on as well as nurses have.
In the Emergency and Trauma Centre, we acknowledge that hand hygiene is an extremely important aspect of our practice and can contribute to significant patient outcomes. We've developed a hand hygiene working group, and that consists of a very proactive, engaged and enthusiastic group of nurses. Up until recently, we've got new members of the hand hygiene working group involving a medical representative and the team lead of the spotless orderly group. We're always looking at new ways and strategies that we can employ to increase staff's awareness around the importance of hand hygiene. So up until date, we've started with some basic things like increasing our signage. We've got a very small hand sticker that sits above the aquarium bottles, and that's basically there to remind you this is the hand hygiene. We've also developed screensavers specifically for our department, and they incorporate photos of a group of staff across the department, and underneath each photo there's a caption around hand hygiene. For example, have you washed your hands today? And they're displayed on all our PCs within the department, and it's a way of engaging staff and getting their interest and improving their practice. We have seen some significant improvements, and obviously it's an area of continual challenge for us. We had a focus week that we conducted at the end of March and April of this year, specifically for hand hygiene in the emergency department. And what that involved was the working group members wearing their blue t-shirts, which indicated they were a member of the working group, and hand hygiene champions on the floor. After the focus week, we saw a significant improvement in our overall compliance, so it was a great success. Staff have embraced hand hygiene and are certainly more proactive in stopping and thinking about what they're doing, and we are seeing that reflected in our monthly audits.